So chapter 11, you're going to find a lot of this to be review, I think. I think a lot of these topics we've kind of touched on. Sometimes I feel like I'm hitting them so much that I'm driving you guys crazy, but it seems like repetition helps. So if I'm repeating, forgive me, but hopefully it'll help some of this information stick. Dental images, as we know, is just a photographic image produced on either film or a sensor. And we do this by x-rays passing through the teeth and the supportive structure. They are, you want to remember, x-rays are a two-dimensional representation of a three-dimensional object. So there are times that it's difficult to see things on an x-ray because it's not 3D. Some of you have had the privilege of working in an office that does have 3D cone beam volumetric imaging that's out there now, but the majority of offices don't. So we're going to be dealing with a two-dimensional representation of a three-dimensional object. And as we know, dental images are a necessary component if we're trying to provide comprehensive patient care. So that's where, you know, a dentist has to decide if you have one of those patients that's just I don't want x-rays no matter what. There were times that my doctor kind of parted ways with those patients because he did not feel, you know, especially if you got even an inkling of a thought that there's something going on, you don't want to supervise neglect. So that's up to the dentist to decide if they're comfortable with keeping a patient on that is not about x-rays. So it's very important to have those on a pretty regular basis so that we can keep up with their health. They're important for diagnostic purposes, obviously, for decay and periodontal disease, and even for lesions. They enable us to identify many things that would go undetected had we not taken x-rays. They provide a lot of information about our teeth and the supportive bone structure. An oral exam, when we look in the mouth, you know, we know that limits us to a knowledge of only what we can see clinically. The interproximal areas, for example, that's why bite wings are so important. Many times we can't see interproximally unless people have spaces between their teeth. So that's another important factor with x-rays. The other thing, I put this image in there because for me, one of the biggest things that I think dental images are important for is patient education. Being a dental hygienist, that is one of our big jobs. We're educators. We're teaching them how to brush their teeth. I know that sounds crazy when you're dealing with an adult, but many people do not know the proper way to brush their teeth or how often they should brush their teeth or what kind of toothbrush they should use. We're teaching them how to floss. Some of them have never had a piece of string in their hands ever. And if they do, they cause more trauma than they do good. So we need to teach them proper ways to do that. We can also teach them about additional dental aids that are out there if they can't floss or if they have arthritis and issues with holding on to things. We can educate our patients greatly. We can detect diseases, lesions, and conditions of the teeth and bone that we can't identify clinically. A lot of that stuff is only seen like within the bone on an x-ray. We can confirm decay or any suspected diseases. If someone has something lodged, like for instance, let's say, God forbid, you're working and your instrument breaks off down in the gum, the tip of the instrument, we would take an x-ray to locate that before we go digging for that. So, people have broken things off in the floor of their mouth, whatever, and we can use an x-ray, and we're going to learn the different localization techniques that we can use with x-ray. It is an essential component of a patient record, not only for the care that we're providing, but also, God forbid, if you'd have a legal issue. So it's very important for that to kind of CYA, as doctors say, cover your rear. Follow-up images can be compared with initial images and examined for changes. So that's a really big thing. And I know I talked with you guys in lab about using an XCP and how that improves that ability to compare from previous x-rays to x-rays by calibrating our radiography. This is an example of if you see that huge radiolucent or dark lesion in that jaw, that patient has an issue going on. It could be either a follicular cyst or dentigerous cyst, or it could be an OKC. An odontogenic keratocyst is one that's associated with nevoid basal cell carcinoma. So there are lots of things that we can identify in the mouth that could also be representative of another condition going on in their body. The primary benefit of our x-rays is to detect disease. And if we feel that the benefit of taking the x-ray is going to outweigh the risk of the small doses of x-radiation, then we can feel okay about taking that x-ray. The dental images can minimize and prevent future problems. So hopefully if we catch something early, like decay, you can arrest it and stop it and treat it before it goes into a full-blown root canal, crown, possibly losing the tooth. So those are the things that we're trying to prevent. It assists the dental professional in identifying and preventing tooth problems. So if a patient is having tooth-related pain and they're not sure why, we can take an x-ray and rule out a periapical abscess. And maybe it ends up that it's just a little sensitivity due to root exposure or something like that. Or we could identify a need for a surgical procedure. So those are the benefits of dental images. And again, we always want to outweigh the benefit should outweigh the risk. What are the risks? The risks are radiation exposure. Luckily, if we're following all of our criteria, we're protecting our patient, we're protecting ourselves. The benefits are disease detection. So that's our risk versus benefit. Information found on the dental images, we can determine if there are teeth that are missing, if a patient has supernumerary teeth or extra teeth, impacted teeth that we can't see by looking in the mouth, which the number one thing we find are third molars, dental caries or decay, perio disease, any abnormalities with the tooth. Lots of times on older people or people that have had a high decay rate, we'll find retained roots that have kind of been covered up by gum tissue and they don't even realize they're there anymore. Possibly cysts and tumors like the image that I showed you. The dental radiographer. We are the dental radiographer. Not only can a hygienist be a dental radiographer, but anybody that has the knowledge and skill requirements to take an x-ray would be considered a radiographer. Now I know I shared with you guys that I was an assistant trained by the doctor, never had any formal training on taking x-rays. That's a little scary to me now, being a rad tech and teaching this course and knowing everything that I know now. It would be nice if they would kind of monitor that and assure that we at least have some sort of in-office training to make sure that anyone that's firing ionizing radiation at patients has an idea of what they're supposed to capture and the safety factors that we need to follow. But anyway, a dental radiographer could be a dental auxiliary, it could be the dentist, it could be us. And we have knowledge and skill requirements that we have to meet. We have duties and responsibilities to our patient that we need to follow. And we should have professional goals of providing a diagnostic radiograph. The knowledge and skill requirements that we have is what you're learning in my class. And I know at times you think, why on earth do I need to know all of this? And I felt the same way as a student. But it all boils down to providing the best patient care we can and understanding what we're imposing on our patients. So we have a basic understanding of the history of radiation. We have a working knowledge of the radiation physics and characteristics that affect our images, how that affects the biological tissue, and how to protect ourselves and our patients. We are familiar with dental x-ray equipment. We understand film, even though we're not using film anymore. You guys will understand film and how that works, the image characteristics, the processing and quality assurance that needs to take place in order to provide the best image. patient management basics. That's what we're going to start talking about soon. And that's the part that I really like sharing with you guys, because that's what we deal with every day. How do I manage a challenging patient? How do I manage a gagger? And believe it or not, in the beginning, you're going to be scared to death and you're going to give up and walk away. But now that I've been doing this as long as I have, I love a challenge. Give me a challenge and let me figure it out, because I will figure it out one way or the other. Very rarely am I beaten. The only time that I am beaten is when I have a little bitty kid that we're trying to get x-rays on. And to me, it's more important for them to have a pleasant experience and want to come back to see me than for me to force the issue, cause them to gag, possibly vomit. I don't want to create a horrible experience for my kiddos. So in kiddos, a lot of times I'll give it a cut 2, maybe 3 really good tries, and then if it doesn't work, we'll just get them next time. So that's the only time that I give up. What's funny is to look at these images and look at these people. We don't have glasses, we don't have shields, we don't have masks, we don't have gowns. Whole different world today. All right, that is all for chapter 11.